All right, welcome to week 27. I want you to take a nice deep breath because you've just hit a huge milestone. You are officially in your third and final trimester. This is it. This is where everything starts to feel so real and, honestly, really, really exciting. So let's dive in and see what this incredible week has in store for you and your baby.
So right off the bat, something pretty magical is happening this week. For the very first time, your baby is opening their eyes. And that just brings up this amazing question, right? What does the world actually look like from inside the womb? Well, let's find out. First things first, let's focus on the star of the show, your baby. Because this week is absolutely packed with some of the most amazing developmental leaps we've seen yet. Okay, so picture this. After months of being fused shut, your baby's eyelids are finally gently parting. Now, their vision is still developing, so it's not like they're seeing in high def, but their world isn't totally dark either. As the wall of your uterus thins, it lets in this soft, kind of reddish glow. They can even perceive strong light from the outside, and might even blink if there's a sudden loud noise nearby. How cool is that?
And this incredible new sense is all thanks to the retina, which is working overtime, building these special light-receptive cells. You've got the rods, which are for black and white vision, and they're forming right now. The cones, which detect color, they'll come along a little later. So essentially, the entire wiring system for sight is being meticulously laid down as we speak, connecting their brand new eyes to their rapidly growing brain.
And you know, this amazing vision development is happening right alongside a couple of other critical things. On the left, you can see the umbilical cord. That's their lifeline, right? It's bringing them all the oxygen and nutrients they need. And then on the right, you've got a glimpse of another huge milestone. Your baby is already practicing breathing. They're inhaling and exhaling amniotic fluid. It's the perfect rehearsal for taking that very first breath of fresh air. All of this is happening while their motor skills are getting incredibly refined. I mean, think about this for a second. Their movements are now so well coordinated that they can bring their hands up to their face without accidentally poking themselves in their newly opened eyes. They're even stretching out their little fingers, getting ready to grasp things for the very first time.
And it's not just about physical coordination. They are practicing everything they'll need for life on the outside. Ultrasounds have caught them practicing different facial expressions, coordinating thumb sucking to soothe themselves, and even sticking their tongue out. It is a full-on dress rehearsal for being a newborn.
Okay, so we've had a good look at what's happening inside the womb. Let's zoom out now and talk about your world, because there are some profound changes happening in your own body and mind too.
Just to give you a sense of the scale of these changes, get this. Your total blood volume is now 50% higher than it was before you were pregnant. 50%. That is a staggering number. And it's a huge reason why you might be feeling a bit more tired or getting out of breath more easily. It's just a powerful reminder of how unbelievably hard your body is working right now.
Of course, one of the most direct connections you have with your baby right now is feeling all that movement. You're probably noticing a pretty distinct pattern by now. And don't be surprised if that pattern involves a dance party the second you lie down to go to sleep. It seems like the moment you try to relax is exactly when they decide it's time for gymnastics. As wild as it can feel, remember, those kicks are a fantastic sign that everything is going great in there.
You know, all these physical and hormonal shifts can bring on some pretty big emotional shifts too. And as this quote really highlights, all the stress and anticipation can put pressure on even the most solid relationships. So when you find yourself in one of those tense moments, it's worth asking that question. Is this really important in the long run? So often, the answer is just no. Remembering the big picture is everything.
You might also notice this powerful, almost fierce protective instinct kicking in. Suddenly you're more aware in crowds, maybe a little more cautious when you're driving. That is a completely natural, primal part of becoming a parent. And just remember, your baby is incredibly safe in there. Perfectly cushioned by amniotic fluid, they're in the safest place they could possibly be.
All right, let's switch gears and get into some practical, actionable advice to help you navigate this week and all the ones to come. Consider this your Week 27 toolkit.
Back pain is, let's be honest, one of the most common complaints of the third trimester. So let's quickly run through 5 simple but really effective strategies. The real key here is being proactive. So staying strong with gentle exercise is huge. Using a support belt can feel like a lifesaver. And a little trick, sleeping with a pillow between your legs can make a world of difference for your alignment. And of course, don't forget to stretch and make sure you're sitting with good back support.
As you start looking ahead to labor, now is a great time to explore different ways to prepare. You might have heard of HypnoBirthing.
It's a method that focuses on deep relaxation and visualization to help you feel more in control and less anxious. Now, like any new skill, the key is to practice, but over time, these techniques can become second nature, really paving the way for a calmer birth experience.
Now is also the perfect time to start thinking about newborn practicalities, especially safe sleep. The expert advice is actually really simple, but it's so important. You want to start with a firm crib mattress and just use a fitted sheet. That's it. Keep the crib totally clear, no blankets, no pillows, no cute stuffed animals, to reduce the risk of SIDS. If you're worried about them being warm, a sleep sack is the perfect safe alternative.
And finally, just a quick heads up on a common medical check-in. Right around this time, your doctor will probably bring up the glucose tolerance test. This is just a routine screening for something called gestational diabetes, which is a temporary form of diabetes that can pop up during pregnancy. It's a totally standard and important part of your prenatal care.
So, we've seen how your baby is busy practicing every single skill they're going to need for their big debut into the world, which really just leaves one final question for you. What's one thing you can do this week to practice for your new life with them?